Congratulations, Abhijeet.
Thank you so much, ma'am.
You have got 170 rank. कैसा लग रहा है?
शहद खा के मैम किसको मीठा नहीं लगता है बहुत ज़्यादा अच्छा लग रहा है, बहुत ज़्यादा अच्छा. It's top of the world feeling. Very good.
So डॉक्टर के बाद सिविल सर्वेंट. अच्छा, ये बताओ 215 आए इंटरव्यू में. What worked?
मैम सच बताऊं तो नहीं पता. जब मेरा इंटरव्यू हुआ, मैं रूम पे आया था, काफ़ी मैंने 100 से ज़्यादा बार अपना इंटरव्यू रिकॉल किया. मैंने सोचा कैसा गया. मैं रो रहा था कि यार इसका आंसर नहीं दे पाया, इसका गलत आंसर दे दिया, कहीं मैं रूड तो नहीं लग रहा था. बट इवेंचुअली इट वर्कड. मैं आपको बस ये बता सकता हूँ कि मुझे अपना इंटरव्यू याद पूरा है क्योंकि मैंने 100 बार रिकॉल किया है. तो प्रोबेबली वी कैन रिक्रिएट इट एंड शायद बाकी लोग हमें बता सकें क्या वर्क करता है, क्या नहीं वर्क करता है.
दिस इज अ गुड आइडिया. क्योंकि अभी तक ये नहीं पता है कि असल इंटरव्यू में कैसा परफॉर्मेंस होता है और उसके मार्क्स कैसे आते हैं. तो लेट्स रिक्रिएट.
आई एम अप फॉर इट.
This video is a recreated simulation of the interview experience based on the candidate's memory and interpretation. It does not represent the exact or official proceedings of the UPSC interview. The intent of this content is purely educational and informational. We hold the highest respect for the dignity, integrity, and confidentiality of the Union Public Service Commission, UPSC, and its members. No part of this video is intended to misrepresent, harm, or question the institution or any individual associated with it.
मैं अकाउंट मैम. गुड मॉर्निंग मैम. गुड मॉर्निंग मैम. गुड मॉर्निंग सर. गुड मॉर्निंग सर.
बैठो बैठो बेटा. आराम से आराम से.
सॉरी.
Oh, you are Abhijeet from Panna. You have studied from Safdarjung.
Yes.
And working in MCD, permanent job. Okay. So, can we start with a question on pharmaceutical sector?
Definitely yes.
So tell me, why is India called the pharmaceutical capital of world?
Ma'am, India is called pharmacy of world for 3 reasons. One is we are doing good in the generics production. 2, our vaccine production is also very good. We are actually providing 60% of the WHO's vaccines. And also we are doing good in the API, though our neighbor is China and we lack from it, but still we are doing some good in API production as well.
Not that great. We are still importing 90% of our API from outside. Well, how are we able to produce so much API? And how are we able to produce so much generic?
Ma'am, probably the supply side factors like skilled labor. I do not know.
Okay, I'll give you a case study. So you are SDM of a district and you have limited budget. Now you have to make a choice. Either you can build a PHC or you can renovate the existing hospital into a super specialty block. What will be your decision? Or rather, how will you take this decision?
Ma'am, before answering this question, I just have 1 or 2 questions. One, is there any super specialty hospital existing in that district or not?
नहीं है बेटा.
Or if there is no, how far people need to move to get a super specialist or treatment?
Very far.
Ma'am, from my personal experience, I think by default my answer would be to build a PSC, because when I saw people coming to the Safdarjung, it was not that because Safdarjung is a very good hospital, because our existing PSCs has failed to deliver. A hypertensive emergency patient coming to the Safdarjung hospital for a stroke is not because Safdarjung is good to manage stroke, because PSCs has failed to do a continuous treatment of antihypertensive drug to the patient. However, if the existing super specialty blocks are very far and the need is real, like there is high prevalence of cancers and other advanced diseases in that area, super specialty, building a super specialty block can also be considered.
Okay, so I'll give you a statement. Weaponization of space. What do you understand by this?
Can I take a moment to think on it?
Yes, sure.
Ma'am, I can think of two possibilities. One is that existing space technology is used for the military purposes, like the space GPS technology is used for getting accurate knowledge of the enemy, like we have used in Operation Sindoor. Other possibility is like putting some missiles in the space to kill the satellite of enemy nation. These are the two possibilities that I can think of.
Recently, the weaponization of happened somewhere. Can you recall it? Where?
Ma'am, I can think of when the USA has denied us the GPS access in the Kargil war.
No, you are going too far. So it was used during Russia-Ukraine war.
I'll definitely read it.
Do you think that India should also go for weaponization of space?
I think there would be a lot of competition in the space. A lot of countries would send their satellites there, and probably a lot of crowding of the satellites would be in the space. However, I feel that we should try to have a global consensus. If we can have a global consensus, then it's fine. But if not, why shouldn't we do this? We should definitely do this because of national security reasons.
So that's obvious, but do you think that India should indulge in it?
Ma'am, if the global consensus is met, India should not. But if it is not met, we should indulge in it.
Okay. So do you know what is moonlighting? And do you think that it is ethical?
Ma'am, before answering, can I try to define moonlighting so that we are on the same page while answering this?
Don't worry, I'll define it for you. If someone is doing a secondary work along with their primary work, maybe in some other country, and without the consent and information of the first primary employer.
Definitely. Ma'am, there are some financial incentives for the people to do it. However, I just have one question, that while working for the second company, if this would affect the efficiency of a person in working in the primary company or not?
You have to tell me whether it affects or not.
Ma'am, 99% yes, it would affect for most of the cases, and thus it is unethical. But there are some people who can do both works and can manage it simultaneously.
But how will we know about how these individuals are who can manage both, and what are the parameters to judge them?
That's difficult. That's very difficult. I think that individual can only tell what are those. I think it's very difficult.
Okay.
We have done well in medical science. We could eliminate polio, but why not TB?
So I think we are dealing with the TB as a medical problem. However, it is a social problem. Malnutrition, stigma, sanitation, overcrowding, these all are the factors that affect the TB outcomes. And we are just dealing the TB as a medical problem. Also, I feel we are not doing good in active surveillance. For example, if I diagnose a patient with a TB and he has already spread it to the 10 people, and if I do not do contact tracing, and let's suppose I do a contact tracing of 7 people and fail to get a contact tracing of 3 people, these 3 people will again spread it to the next 10 people. So it would not give us a desired result.
You are from Safdarjung. There is a specialty which is not found anywhere in India. What is that specialty in Safdarjung?
Sir, can I take a guess?
Sports medicine.
Oh, sir, we got 2 SIC centers, sports injury centers right now in that. That's right, sir.
Okay. Debate is going on that the age of retirement for doctors should be increased to 70. And we have a shortage of doctors also. And doctors are refusing. What is your take on it?
So I think we can increase the retirement age up to 70 years because of two reasons. Number one, uh, as the age of the doctor increases, probably the skills become more polished, and we are at the shortage of the doctor, as you have rightly mentioned. However, I feel we are living in the age of artificial intelligence, where AI generated medical things can also be applied in the society. Also, almost more than a lakh MBBS doctors are now freshly passing out every year. We should also work out somewhere that we can utilize these things, AI and the new doctors, to increase our workforce rather than just pushing them into here. Because old people also have their life and they should also live their retirement life fully. So we should give a chance to the alternative options as well.
Okay, Abhijeet, what Panna is famous for?
Sir, Panna is famous for its diamonds.
Diamonds. Okay. Can you tell me the journey of diamond? I mean, where the diamond goes from Panna?
Sir, from Panna, usually the diamond is mined in Panna, the Majgawa range. From it goes to the Surat for polishing and
Surat.
furnace.
Okay. From Surat?
Sir, from Panna it goes to Surat and Mumbai for the polishing. Then it goes to UAE, it goes to US, and in Europe and the Belgium as well.
Belgium. Which place in Belgium?
Sir, I'm unable to recall it right now.
I think it's Antwerp.
Oh, yeah, definitely, sir, definitely. It's Antwerp.
Yes. Abhijeet, can you tell me why civil services after MBBS is something a new phenomena, or was it in your mind right from the beginning?
Sir, it was not in my mind from the beginning, though my parents used to say about IAS and IPS. It is almost the new thing in my mind recently, a year back only. Why I want to be into the civil services is because post MBBS I was just looking for the career options. Doing MBA from the IIM was the one. Doing AI research in the medical field was the two. Probably doing post-graduation in the medical was three, the most obvious one. And the civil services also one. I think civil services is offering a very diverse work opportunity that I may not find in the medical, because in the medical side there is a trend of specialization and super specialization. If and the niche is becoming narrower and narrower. If I become a nephrologist, I might be seeing only 6 type of case for whole of my life. So civil services offering a diversity. However, I may not say that social prestige is not.
Okay, prestige. Okay. Okay, you were talking about primary health.
Yes.
Can you tell me which thing you will like to join in primary health? Which department?
So I think sanitation and nutrition, if joined with the primary health, would give a holistic perspective.
No, think something else.
I think primary education.
Yes.
Abhijeet, can you tell me what is this AIR for in UPSC CMS?
Sir, UPSC conduct examination known as Combined Medical Services Examination, and I got rank 4 in that examination.
Abhijeet, you must be very bright. You're speaking this good. You are looking handsome. You are that young doctor which should do good in India. You have AIR 4 in CMSL. Then you have AIR 65 in AIDS. Having all this good qualifications that the board have also seen, why do you think that doctors in last 5 to 6 years are not going to US? Because in our times, the good doctors were going to US only.
I think most probably after coming of Ayushman Bharat and the recent changes in the Trump policies, the doctors might not going to the US. And one of the reasons that I can comment from a personal experience is that most of the doctors were going to the US with a herd mentality. They actually do not know what is in the US, but they were going there because everyone in the senior was going there. After coming of the Ayushman Bharat, there is a demand generation at the rural areas and the tertiary, third tier cities as well. And because there is a demand generation and the doctors can earn more, earn a substantial amount at the third tier cities as well, I think the doctors are moving towards the better opportunities in India as well.
But still, the remuneration can't be matched. And why are you not going to US?
Definitely, sir. Remuneration in the US goes around 400,000, 600,000 a year, dollars per year in the US, and it cannot be matched in India. But still, there is a lot of opportunities for the doctors in India. If I come specifically to this question, why I am not going, I do not have a very hi-fi answer for it. It's just because my parents won't go to the US, and I do not want to leave my parents. This is the reason.
That's genuine, Abhijeet. Need not to be hi-fi every time. So Abhijeet, suppose you are an SDM, which I would wish you to be one, and you will be one of the brightest in your batch. So how do you think you will be perceived by your subordinates or the doctors in your district?
Sir, I would love to break this question into two parts. Number one, how the fellow doctors would perceive me, and number two, how my subordinates would perceive me. Sir, I'm very sure that the doctors would be very happy because they consider the civil servants to be arrogant, inefficient, rude, and they would be very happy that there is someone who can take care of them. As far as my subordinates are considered, there can be two possibilities. One, that they might consider me as good because doctors have inherent authority and a leadership ability in the society. However, they can also perceive me as something like he's intelligent, he is bookish, he just know how to handle the patients in the hospital, not the social determinants of the health like nutrition, sanitation. So there might be a mixed bag of opinion, but I'm very sure that the doctors would be very happy, sir.
Okay, Abhijeet. You have interest in AI in healthcare. Can you tell us something about its application in healthcare?
Definitely, ma'am. The role of artificial intelligence in healthcare can be divided into three things. One, in the drug discovery and research. That is, now we have AlphaFold of the Google, a lot of antimicrobial resistance in the country, and we need to have new drugs. And AI is helping out. MIT has recently launched a drug from the AI who has discovered new drug. Second, I think AI can be very useful in the diagnosis. Recently, the chest X-ray machine integrated with the artificial intelligence has been integrated into National TB Elimination Program. We need not to have a lot of need of radiologists right now. AI can do basic screening. Also, the Punjab government has recently rolled out the breast screening via AI tool known as thermalytics, the thermal-based screening of the breast cancer, which preserves the dignity of the women as well. Apart from it, I think we are living in an age when we all have some wearables, Apple Watches, Gablet rings, which is collecting our data all time. And this AI can actually analyze this data and predict early onset of the diseases. And sometimes it also helps to monitor our old age parents and grandparents who are very far from us, and we need to monitor their blood glucose, heart rate, ECG, so that we can get early warning. So AI has a lot of importance in healthcare.
Okay. Do you think a rural patient would go to AI, and also can it penetrate to PHCs?
I think that's very right questions. Recently, the Shanghai metro stations has rolled out the artificial intelligence induced healthcare kiosk at their metro stations, and the patient can go there and take the medicines and just by asking the symptoms, by telling the symptoms. I visited the AI Impact Summit recently held in Delhi. And they are also one startup, very good startup, the Clinics on Clouds. It has launched a health ATM concept, a very decentralized form of this AI integrated health kiosk that would be there in the rural areas. And last, the main thing that we are doing good is that we are collecting a lot of data from the rural areas, rural dialects, rural languages. We have seen the Servam, Bharat Jain differently. They are catching up the rural languages and dialect as well. So if we can have all these things, I think the rural patients would be benefited from it. And the need of the hour is for the rural patients only, because there are the deficiencies of the doctors.
So I think it is at early stage and it would take time to reach to PHCs.
Oh, definitely, yes, ma'am. It would take some time. It's at an early stage.
Just one question from my side. Which country have you preferred as your home state?
Sir, I have declared Delhi as my home state, but opted out from it.
Okay.
Thank you, Abhijeet.
Thank you. Thank you, ma'am. Thank you, ma'am. Thank you, sir. Thank you, sir. Thank you, ma'am.